Good morning, everybody. I am Dr.po Raval, 35 years in practice as a podiatrist. Today we're going to talk about shin splints. What are they and how can we treat them? So shin splints or shin splint pain comes from this area. This is the tibia or the front shin bone, and this is the muscle, the tibialis anterior, that inserts onto the shin bone. So what causes shin splints? Actually, it is not the tibialis anterior, but rather this entire complex in the back of your leg. This is the posterior tibial complex. Gastrocs and soleus muscles are the two big muscles on the back of the calf. So shin splints is in an area that's very vulnerable because tendons and ligaments do not have blood supply, but muscles do. So tendons and ligaments just pull and produce scar tissue. You have to engage muscle to increase blood supply. So the first thing you want to do, since shin splints are caused by a tight calf muscle, is stretch the calf. So stretching, I find the easiest stretch is both feet on a step, and one at a time. You're going to drop the leg, count of 10. So you're pushing, count of 10, up, pushing, count of 10, up. You're going to do 10 of them morning and night on each leg. Should stretch the entire posterior tibial muscle complex. That should give you some release on the shin muscle, the tibialis anterior. Most people should not stretch the tibialis anterior because if you stretch it, all you're doing is pulling on the shin bone, and that makes your shin splint pain even worse. So stretch the posterior tibial complex. That's number one. Number two, you want to reduce your level of activity, walking or running, down to half and increase only by 10% per day. I find that adding anti-inflammatories at the same time, morning and night, helps. So you definitely want to add anti-inflammatories in the first 2 weeks when you're trying to increase activity. That'll reduce inflammation. The next item is check your shoes. So shoes should not have a wobble. We talked about this in another video, but when you put a shoe on a platform or a table and you hit the back, there should be no wobble. If it wobbles, replace the shoe. Also, you want to add more shock absorption into the shoe, a very good insole with a lot of bounce. All right, so shoes, insoles, stretching, neck and level of activity. If none of these helps within 4 weeks, you definitely want to see a podiatrist for either a custom insole or a prescription for physical therapy. What physical therapy does differently is they will take this shin bone and they will heat it, put ultrasound to break up all the scar tissue, deep tissue massage to get rid of that scar tissue, and put you into a stretching program 3 times a week, 4 weeks. Shin splint pain should not last more than 4 weeks if you're doing this routine. Hope this is helpful. Tune in.